Of all the self-fulfilling prophecies in our culture, the assumption that aging means decline and poor health is probably the deadliest. Marilyn Ferguson. The wellness plan that I'm going to present you with today will be applying the essential wisdom from the Blue Zones to create a purpose-built, mature-age residential community, fostering improved vitality and happiness. So what are the Blue Zones? The Blue Zones are the areas in the world in which there is a high prevalence of centenarians, such as Sardinia in Italy, Okinawa in Japan, Loma Linda, California, and the Nicoya Peninsula, Costa Rica. Research from the Blue Zones found commonalities across all these populations, including the consumption of a modest and mostly plant-based diet, participation in daily activities, connectedness with family, and engagement in social activities. What does this mean? While Australians are living longer, it's important to consider the implications that this will have on the economy and availability of healthcare and services. Many of the factors that influence an individual's health and wellness as they age can be attributed to behavioural factors. Ageing no longer needs to be synonymous with illness or a decreased enjoyment and zest for life. Currently, there is a lack of purpose-designed residential communities that can effectively support and enhance the well-being of older Australians. Depression and depressive symptoms are prominent in older Australians, significantly reducing quality of life, leading to declined health and overall well-being. Ageing often leads to the deterioration of external circumstances, with people aged 60 and over increasingly reporting suffering social isolation and poor health. According to Lelkis 2008, 1 in 7 people in their 60s reported they did not have friends that they could share personal matters with. Social connection impacts well-being across the lifespan. However, in older populations, it is a known predictor of both functional decline and premature death. Loneliness carries health risks equivalent to risky behaviours such as smoking 15 cigarettes a day. Loneliness was linked to several physical and mental health issues and was associated with an increased risk of all-cause mortality, including depression, cardiovascular problems, altered immune function, and Alzheimer's. The good news is, strong social environments provide buffers against adversity. The World Happiness Report concluded that social environments are of first-order importance in determining quality of life. Sociability appears to play a role in protecting individuals from experiencing psychological distress and enhances well-being. Although aging is linked with an increased risk of numerous health conditions, disability and dependency, many of the chronic conditions are not an unavoidable consequence of aging. Many of the aspects influencing an individual's health and wellness can be attributed to behavioural factors. As you can see in Figure 1, many of the 5 leading causes of death for older Australians will be addressed using the research conducted in the Blue Zones as a model for best practice. What is the plan? The solution lies within a reimagined retirement facility, or rather a community of mature individuals living within a setting that facilitates the significant lessons learnt from the Blue Zones. The wellness objectives aim to design a community that fosters the healthiest lifestyles for individuals. The use of data from the Blue Zones communities is essential to make healthy choices the easiest choice, but also the inevitable choice. The specific population targeted in this intervention is individuals, both male and female, aged 60 years and over, willing to relocate to a purpose-built, mature-age residential community. The goal is to decrease both morbidity and mortality, in particular lifestyle-related diseases such as coronary heart disease, diabetes, and obesity. To examine if designed communities prioritizing social, physical, emotional, intellectual, spiritual, and environmental health will lead to enhanced longevity and wellness, enabling comparisons to be made between individuals living in aged care facilities across Australia with designed communities, and how this impacts well-being, longevity, and vitality. So the exclusion criteria will be individuals that need a full-time carer or hospice facility. However, inclusion criteria will include participants with previous or current health conditions, as long as they are able to live in a residential setting without full-time assistance. The following will be implemented in the design of a purpose-built community to address the 7 dimensions of wellness: making movement natural and part of the environment, such as gardening and walking, eating mindfully or until 80% full, encouraging time to enjoy meals, and reducing overeating, addressing physical health. Spiritual, occupational, and emotional health will be maintained by supporting a sense of purpose by creating opportunities to contribute, for example, charity work and service work. Reducing stress by creating healthy habits like meditation, book clubs, exercise groups, targeted at improving intellectual and physical aspects of health. Physical, environmental, and social health can also be optimized by encouraging the consumption of a plant-predominant diet. Easy access to grocery stores or local farmers markets and community gardens can foster the consumption of plant foods, and community potlucks or cooking demonstrations on how to prepare these foods, with natural spaces and areas to experience outdoor activities. Interestingly, the consumption of alcohol that is mindful and fosters social connection, obviously following the Australian guidelines to reduce health risks, seems to increase social and emotional health, developing a sense of belonging and spiritual health with the encouragement of faith-based practice or spirituality, networking and connecting with loved ones to foster emotional health, and finding social connections that support healthy behaviours, like interest groups that will ensure aspects of social, intellectual, and physical health are all met. The findings extracted will dramatically advance our understanding of how quality of life and longevity can be supported by purpose-built communities. So let's get into the finer details of the wellness plan. As part of the community design, the following programs, facilities, and opportunities will exist for residents to support well-being. In order to encourage people to be more physically active, the following will be implemented: wider pedestrian footpaths with walking and cycling lanes to ensure easy and safe opportunities for activity. Facilities such as parks and halls for indoor activities such as group fitness and yoga must be within the community or close walking proximity. Town centres have to be within walking distance to access shops. Research supports that the built environment around a community influences physical activity. Inaccessible or non-existent footpaths contribute to sedentary habits. Nature spaces to encourage being outside, such as community gardens and parks, will give residents the opportunity to connect with the environment. Figure 2 illustrates an example of how a Blue Zone-inspired community should be built to maximise well-being. This will be measured by surveys of the community, detailing the amount of physical activity they complete, evidenced by assessments of physical fitness and wellness biomarkers. Proximity to faith services and opportunities to practice faith, including running prayer or worship sessions in community facilities. Research demonstrates that participating in faith-based services 4 times a month can add approximately 4 to 14 years to life expectancy. Although many older Australians may be retired, the benefits of involvement in volunteering and charity will be available to residents to facilitate a sense of purpose. This has been shown to add up to 7 years of extra life expectancy. Support services available such as stress management practices, spaces to connect with their family and friends. We know that stress has been linked to chronic inflammation and age-related diseases. Many centenarians have routines to cope with stress, from praying in the Adventist population to people in Sardinia having happy hour with friends, so raise a glass of wine and say cheers. Providing occasions to participate in learning activities such as healthy cooking classes will enhance overall experience of emotional and intellectual well-being. Social support groups and interest groups such as bushwalking clubs, plant-based potlucks, and yoga classes will be encouraged. It is evident that the world's longest lived people are part of social circles that support healthy behaviours. Many of the markers of well-being will be assessed via surveys of residents and their perceived levels of happiness and wellness. This will be coupled with the assessment of biomarkers. A clear picture of well-being can be assessed through a decrease in chronic and avoidable diseases. So what benefits will the people receive from this wellness intervention, and why is this important? As research indicates, many older Australians report depression and loneliness, which directly impacts their overall well-being and life satisfaction. Based on population research, this wellness intervention is likely to decrease levels of depression and loneliness, enhance feelings of connectedness through social interactions and a sense of purpose, as evidenced through surveys of the population, decrease incidence of chronic diseases, diabetes, obesity, coronary artery disease, colorectal cancer, and cerebrovascular disease, addressed through increased physical activity and the consumption of plant-focused diet of whole foods. Increased longevity, particularly seeing an increase in quality of life assessed through biomarkers and surveys of well-being. I'd like to leave you all with one last thought from Nelson Mandela, who said, "A society that does not value its older people denies its roots and endangers its future. Let us strive to enhance their capacity to support themselves for as long as possible, and when they cannot do so anymore, to care for them."